You're listening to the Heart of Giving podcast with Art Taylor, powered by bbbgive.org. Here we explore the motivations that form the basis of giving and service. We inspire generosity and celebrate the transformative effects that giving and service have on the human spirit and on community. The conversations featured on the podcast also uncover giving strategies that educate and provide tools to help listeners make impactful gifts of both their time and money. We hope you enjoy this episode.
This is the Heart of Giving podcast, powered by bbbgive.org. Give.org is the nation's standards-based charity evaluator, and it's your one-stop source for information on giving and reports on the most asked about charities. I'm Art Taylor. I'm at a conference today hosted by the Salvation Army, and I just finished one interview, and now I have the distinct pleasure of doing another, this one remote, with Rick Lofgren, who is the CEO of CODA. And he's going to tell us about the work that his organization is doing to help people who are dealing with the need for organ transplants and the important challenges associated with that and how they're going about addressing them. So, Rick, welcome to the Heart of Giving podcast.
Well, thank you, Art. It's a pleasure to be with you today.
Rick, so first of all, I'd like to know a little bit more about you and your journey to this organization, if you don't mind telling us just a bit about your background.
Well, Art, I was hired by CODA about 26 years ago, and part of the reason why this was so important to me when I went through the interview process was I had a cousin that had leukemia and had a bone marrow transplant at UCLA Medical Center back in 1976. The type of leukemia that my cousin had, Art, had a 3% survival rate at that time. Today, that survival rate is 97% over 5 years for that exact same diagnosis. So being part of an organization that's on the cutting edge of some things that are going on in the healthcare community is just remarkable to me. But that's my family's connection to transplant. And this is a job that I love and have enjoyed for 26 years every day, knowing that I'm able to help those families, much like our family needed help, but CODA didn't exist back in 1976.
Well, and we can do so much more today with transplants than we could years ago. How have you seen this begin to shift over the last 26 years since you've been with the organization?
I think it's shifted dramatically, and that's one of the exciting things about being in this field is that medical technology and surgical practices have made what used to be a death sentence a pretty common thing today. We have transplant patients that are 20, even 30 years post-transplant and doing very well. I talked to a young man that had a liver transplant 33 years ago, and he's doing very well. He was 2 years old at the time. He's now a dad, and he's still accessing funds that were raised in the CODA campaign that was conducted in his honor many, many years ago. And just exciting to see that those kind of life transformations have happened, and to be a small part of that has been just fantastic.
So let's talk about CODA. How does your organization go about assisting people who find themselves in this situation?
Well, what we do is we promote our services to the transplant centers that are the primary pediatric centers around the country. There are about 35 that we get to on an annual basis, and we talk about how we help families everywhere from helping them do fundraising and using volunteer teams to do that, and then paying expenses for those families for a lifetime. What we'll do is go into a family's hometown. We'll work with the volunteers, and it's oftentimes someone from their church, from their school, maybe a grandparent that leads that community effort. And we really ask mom and dad to focus on their child and let us work with a volunteer team so they can focus on the medical needs, and then we'll focus on the volunteer engagement and fundraising and marketing the campaign. And then we pay those families' expenses for their lifetime. And like that young man I mentioned in Arizona, we were able to do that for many years and oftentimes many decades to help with those expenses that come alongside any transplant. The sad thing, Art, is that there are more people that need a transplant than there are organs available. And every day in the United States, about 18 people pass away waiting for that life-saving transplant that never comes. And so our goal is to make sure that money is not the issue that keeps that from happening. and continue to pay those bills so that the family can focus on healthcare needs and not on the costs.
Well, those expenses can be quite sizable, I would imagine. What do you do to go about getting people interested in supporting these various challenges to meet the financial obligation?
Well, we'll do a lot of work in a patient's hometown, both with the media and traditional media as well as social media. Um, I think one of the things that we're finding is a lot of our parents are much more adept and adroit at using social media. And so we see a lot more traction there. I can tell you we have families that are very active on TikTok, on Instagram, on Facebook, and they're able to promote the fundraising activities very well. And then we'll train the volunteers to actually do the fundraising activities, everything from just a Facebook fundraiser that raises sometimes hundreds or low thousands of dollars, all the way up to events like a gala or a golf outing that might raise tens or even hundreds of thousands of dollars. But our part of that process is to help train those volunteers. We accept the money and then pay the family's bills. And so that's never considered income for the family. And that's something that we do come alongside to make sure that those families are taken care of. And if they have Medicare or Medicaid, it does not disqualify them or cause them to have to pay a premium for their benefits.
So, just so that our listening and viewing audience can better understand what we're talking about in terms of cost, what are some of the charges that an organization like yours would have to pay for someone? What are we talking about in terms of, let's say, someone needing a kidney transplant?
Typically, for a kidney transplant, a family would see a bill for $150,000 to $175,000 for the transplant. Then they'll have additional expenses for medications, for their inpatient stay. Many of our kidney patients have dialysis care ahead of time, and so they have significant expenses there. But as an example, Art, we had our annual fundraising event over the weekend, and one of our patient families spoke. Their daughter had a liver transplant in Pittsburgh 8 years ago, and that first year they had billings of over $2 million for her liver transplant. Had some minor complications along the way, but what we do is we help the families with any co-payments, deductibles, their household expenses even, but probably the biggest long-term cost for all of our families are medications, which they have to pay for the rest of their lives.
Yeah, and those medications add up too. So some of these people have some insurance. Is that true, or is that not the case? Are you talking about people who have zero insurance, and how do they find themselves in that situation generally?
Some of our patients have no coverage whatsoever, but the vast majority of our families have private pay insurance. As an example, a family that I spoke with earlier this week, they had a great insurance plan. Dad was a member of the military, and so TRICARE came alongside, and so their medical bills were relatively small. But their difficulty was Dad was at a military base in one state, and the transplant was taking place in another state. And so there was a lot of transportation, lodging, not only for the transplant itself, but for all the clinic visits, all the follow-up care. And then on top of that, because we had to have two households, one at the transplant center, that city, as well as back home again, we were helping to cover costs for the family at both places because there were other children in the family as well.
I see. So you also help with ancillary costs, such
We do.
as housing and transportation and meals and lodging for people who are assisting or either going through the transplant surgery, so that the
Yeah.
family can be together during that challenging time.
And right now, about 60 cents of every dollar that we pay, Art, is for those things that happen outside a hospital building. It's those medication costs, post transplant, it's those costs that you just described that every family is going to have. But when they're in transplant and their expenses have gone up dramatically at the same time that their income has decreased dramatically, it puts them in a very difficult situation.
Are you able to work with pharmaceutical companies to reduce some of the costs associated with those ongoing medications, or are you having to pay the full amounts?
We do have an agreement with a couple of different pharmaceutical companies and providers, and what we try to do is work with them whenever possible. Unfortunately, in many cases, our patients are dictated where they can get their medications from by their insurance carrier, and that presents a little bit of a problem because those costs have been negotiated already, and so we're paying what the set rate is. But for all of our families, there's a copayment or deductible that they have to pay that we would cover those costs regardless of what plan they have.
And how many people are you able to help in your current state right now? And what would be your aspiration?
Well, this past year, we helped 244 new families, and our goal is to reach 300 new families in every year within the next 5 years. When I started 26 years ago, Art, we helped 31 families that first year, and we've continued to grow since then. During the pandemic, things got a little bit different for us with a lot of families not going into the hospital and doing telemedicine care. And the transplant would be the time that they went into the hospital, visit the surgeon, but otherwise it was all much like we're doing with this interview. It was all on the computer. I'm afraid that took us back just a little bit because those families weren't talking to the people in the hospital that would refer them to us. But since the pandemic's ended, we've been able to pick back up and actually are ahead of where we were at this time in 2020.
When you launch a fundraising campaign, how do people in the community generally respond? And what is the, I guess, what is it that drives them to want to give? I guess I have my own assumptions about this, but I just want to be sure. It seems that any one of us could basically look at a person who's going through this and say, but for the grace of God, go I. And if it were me, I would want someone to help me. Is that how most people approach your fundraising appeals?
That's it exactly, Art. A lot of the people that we work with, they have a faith community that they're part of, a school community, perhaps they're part of a military community. Those are the families that those people around them literally wrap their arms around them and help them, whether that's helping get their kids back and forth to school or to clinic visits, helping them with fundraising, volunteering at a fundraising event, not just giving. But those are the kind of things that we try to put communities together within the framework that the family already has. And then also plug in their social networks online to be able to connect with family members and friends that perhaps are a state or two away that still want to help, but physically can't get to them right then and there. Perfect example was during the pandemic, we couldn't do live events. And we found out that a lot of people still wanted to run and would walk or bike. And so we did virtual 5K and 10K events. And we found that since the pandemic's ended, having an event where you have a live component at maybe the kid's school on a Saturday morning, and then family members and friends that maybe couldn't get there at that time or lived too far away, they can still participate. And so we found that those events in a hybrid model really work much better than just one side or the other. And that's really helped our families tremendously.
Yeah. I think about the families themselves and how they must feel when you come along and offer your assistance to them. After they get through it, do you find that they're also contributing back to you in a way that can be helpful to others?
Absolutely. We have what we call a referral list, and it's parents that have told us, someone helped me way back when. I want to give back and help that next family that's coming through this that perhaps doesn't even know what questions they should be asking when something occurs in their child's life. What should we be doing about this? And those families really are great mentors for new families just because they've been there and done that in the past. And so that's been a great benefit for our families. But you're right. I think people want to help and want to be able to show people that are just starting the process, here's how we were able to navigate it. And this might give you some help along the way as well.
I mean, I wasn't even thinking about the counseling and support that people can give based on their lived experience with this challenge. I was actually thinking about the money, but it may be just as valuable to have people offer that kind of advice and comfort and orientation to people who really don't know what the journey is going to be like until they get to the finish line.
Yeah, I think it's one of those statements that I hear repeatedly when I talk to our families is that we didn't know what we didn't know. And having someone that can help them, whether it's the emotional support, their healthcare journey, whether it's fundraising or volunteer management, I think it's something that being able to ask questions and talk to someone that has done it before really is very reassuring and allows them to focus maybe a little more on their child and a little bit less on some of those concerns.
How about your staff? How many people do you have working on these fundraising campaigns? And let me just add, this is a great moment for me to point out how many people focus on the fundraising profession and they put it in a pretty negative light. But we need people to go out and create opportunities for us as donors to live out our philanthropic really aspirations. And fundraisers give us those opportunities. They present them to us so that we can now take what we have and make a difference. But yet sometimes fundraisers get cast in a very negative light, and it's troubling to me. For instance, many donors don't think organizations should be spending money on fundraising. And that is so wrong. How could we ever find donors to contribute to something so meaningful as helping a person get through the need for a transplant, a life-saving operation, without a fundraiser coming to us with that idea or with that need? We need to publicize that and get it out, and that costs money. So I want to just say to people who have a different orientation to the fundraising profession than I encourage them to have, that think about, if you want to be the only donor, then tell the organization not to spend anything on fundraising. But I guarantee you, if you're the only donor, chances are not a whole lot is going to get done without the support of others. And that is not to say that one gift isn't important. Every gift matters. Every single gift matters. And no matter how large or small it is, it makes a difference. But we also have to make sure that organizations have the room and the good sense to believe that they can spend money on fundraising to reach new donors. So I wanted to just get your feedback on that, because you're obviously having to put resources into reaching donors to get these campaigns fulfilled.
And I agree wholeheartedly with what you just said. Our fundraising event this last weekend was to raise money to help offset our costs to do what we do. We have a staff of 20 people, and we pay staff to go to the hometown of where our families are. We train the volunteers in those patients' hometowns to do the fundraising, and then we pay the bills for those families. And without our assistance, those events still could happen, but they probably would not raise anywhere near the amount of money. And that money probably would be taxable income because it would be going into someone's bank account rather than into ours as a 501c3. So I agree. If you are going to make a single gift and you're going to fund one of our campaigns, perhaps at $40,000 or $50,000, God bless you for that. But most of our families don't have those kind of situations, and it takes hundreds of donors who are giving $100 or $250 each to reach a goal of that magnitude. And in our case, we're talking about a lifetime of expenses. It's not just what we need to get to transplant or get home from the transplant. It's what happens many years after the fact. And those expenses just are not something that can come up with, most people can come up with out of their own budget. I have a good example. One of our patients told me that every year their prescription deductible is $2,500. So they pay out of pocket that first $2,500. And that's not just the year that they transplant, Art. It is every year for the rest of their life while they're on that plan. And so if we just say, well, if you think that's going to be 20 years, that's $50,000 just for that cost. That's where a fundraiser can come alongside that family and make a difference.
Yeah, it's interesting. I just believe wholeheartedly that when you're able to give something to someone else, it lifts you up. And having fundraisers positioned to show you places where your giving can make a difference is critical in everything we're trying to do in the nonprofit sector, of course, but also to help people live out their philanthropic aspirations. So I just wanted to say that again. So how many communities are you able to operate in? Might I find you in places all across the country, or are you located more regionally? How do people find you to let you know they have a need?
Well, right now, most of our patients are referred to us by someone in the transplant center that they're working with. It's typically a social worker or a financial coordinator. But honestly, since the pandemic, more and more of our referrals have come from someone who have been part of an online support group. We get a lot of patients. There's a Facebook group called Kidney Moms. There's another one that's Liver Mamas. We get a lot of families that are referred to us because they talk to other families that are going through the same situation. And again, as we talked about emotional support, they also know that families don't know yet what those costs are going to be. And that's where we get a lot of our referrals. But many of our families now, I'm going to date myself here, Art. When I started, everyone used the phone to get in touch with us. Right now, out of every 20 phone calls that we get, we'll get probably 80 to 90 emails or electronic communications through our website. And that has become the most common way people communicate. Oftentimes, families are reaching out to us when they're literally in the hospital room and their child's sleeping in the bed. And mom and dad are sitting there just thinking, I have to do something. What can I do to help my child? And that's when using our electronic resources makes a difference.
So there's a lot of people out there who need this service. You're not able to meet all the need. What's your estimation, though, of the percentage of need that you're able to meet right now?
Well, that's something we're talking about at our next board meeting, Art. About 15% of pediatric cases in the United States every year, we're able to be in contact with those families. And it is a situation where the families contact us through the transplant center rather than us reaching out to them, because there's not a master list of transplant patients. And so we wait for those families to contact us, and then we immediately start working with them. But as you said, it's just a small portion of the total population that needs a life-saving transplant.
Well, it's still a great thing that you're in existence and you're doing the work. Now, you mentioned at the top that we're not able to meet the needs of everyone who needs a transplant. What are the statistics around that?
Right now, every day, about 18 people are passing away, and that's just for a solid organ transplant. For patients that had a bone marrow transplant, like my cousin, that number is going to raise that even higher just because there aren't enough donors. About 85% of Americans, when surveyed, say they believe in organ donation and register as an organ donor, but not everyone actually follows through with that. And so one of the things I encourage people to do anytime I do a presentation is not just help our families financially, but consider registering as an organ tissue donor. You can do that online right now. You can do it whenever you go to your local BMV and get your driver's license renewed. There are a lot of ways to accomplish that. But we always tell families that's a great way to help out someone that perhaps you can't help financially, but you could do that at some point later on down the line. No cost to that whatsoever.
Well, I know when I get my license renewed, which is going to be next year, they always ask, would you be willing to be an organ donor? And I say yes, because I know that these organs can be helpful to someone potentially. Although, I don't know, the older I get, maybe I burn my organs out. I don't know. But if anyone wants them and I'm not here, they can certainly have them. And that's the idea. I think we want to, first of all, face the reality that our time comes, sometimes unexpectedly. But what a gift it is if we can, through our passing, create life or extend life for someone else. I just think that's a remarkable way to live on through the good graces of your organs. And I've heard stories, maybe you have too, of people who've received organ transplants and how they honor the people who passed away, who made those organs available to them. Have you heard those similar stories?
I have, and that's one of the emotional parts of transplant that's hard on our recipient families, because those parents are thinking about someone passed away to save their child's life. What we're seeing more and more now, Art, is what they refer to as a domino donation, where perhaps you need a kidney transplant, Art, but no one in your family or friend network matches you, but they're still willing to donate. The Organ Donor Network would match your friend or family member up with another donor, and that would put you in a priority status to receive a donation later on. One of our families in North Carolina, the mom was a donor. She was one of 12 donors that gave a kidney. She donated, I think it was in May of 22, and her son received his kidney transplant the following April and is doing great. But it was not from someone that was part of their friend network or their family.
If you had to estimate whether we're winning or losing here, now you mentioned that we've gone from a relatively small number of transplant families that you were able to help when you started to a much greater number. Will we ever get to a point where everyone who needs this kind of assistance can actually get it?
I think so. And I will say this, many of our families, when they start with us, have already started fundraising through GoFundMe. Perhaps their local church or their school has set up a fund. And while that's very helpful, we really encourage people to work with organizations that are 501c3s, not only because it's tax deductible for the contributor, but the beneficiary also is not taxed on that. And that's one of the benefits that we offer, is that someone's not going to make a gift, as you know, because of the tax deduction, but it might encourage them to make perhaps larger donation. And that's where CODA comes in and is very helpful to those families. And I think one of the reasons why we're very pleased to be a charity seal holder is that we've been one of those for 19 years. And I think it gives our donors a great deal of comfort that they know that the donations they're making to CODA are being used for what we say we are. Our financial statements are out there and very accessible. But I think you give us that good housekeeping seal of approval by doing that, which then allows donors to feel much more comfortable, not only giving us money, but also to buy into what we're doing. And organ donation registration is one of those things.
Well, we're getting to the end, but I wanted to give you an opportunity to ask people or to share with people how they can be helpful. I know you also do these campaigns, but is it possible for people to just give to your organization without knowing about a particular campaign and have that money distributed in a way that you would think it would be useful?
Absolutely. Anyone can go to our website. It's cota.org, and they can choose a family to help their campaign, or they can make an outright gift to CODA, and then we would use that money to help other families. Every year, we raise somewhere between $6 and $7 million. The vast majority is designated for a local community campaign to help patients, but a big chunk of that money goes to help those families that perhaps you don't know who needs help, but you just want to help someone. And that's part of what our event this last weekend did, was to help make sure that those costs are covered and those families are assisted regardless of where they are.
Well, Rick, I want to wish you continued success with this, and it's important that you are successful. And thank you for joining me on the Heart of Giving podcast today.
Well, thank you. It's been my pleasure.
No, it's my pleasure too. And for anyone who might be listening to this podcast for the first time, it's a weekly show. Every Tuesday, there's a new episode, and we hope you will tune in and subscribe so that you can get them when they come out. And I want to thank you for watching today or listening, depending on how you're getting this. And I hope we'll see you back here again next week.
You've just listened to the Heart of Giving podcast with Art Taylor. Be sure to tune in next time for a brand new episode. To listen to our other interviews, visit heartgiving.podbean.com. That's heartgiving.podbean.com. Subscribe to our show on major podcast platforms. The thoughts and opinions expressed on this podcast are the views and opinions of the guests, not those of the BBB Wise Giving Alliance or program affiliates. This podcast is for information and educational purposes only and is copyrighted with all rights reserved. This podcast is protected by Podbean's terms of service.